I wanted people not just to fight against this possible future that's being created by all the air pollution, that's creating this blanket over the earth basically and causing temperatures to rise, but also to imagine this much better future that we could create for kids. And that's why the final chapter of the book is called The Possible World.
The Chronic Truth Podcast is for informational and educational purposes only. The views expressed by our guests are their personal opinions and do not constitute medical advice. While we share experiences and strategies related to health, neither the host nor the guest are acting as licensed medical professionals unless explicitly stated. Always consult your physician or qualified healthcare provider before making any changes to your treatment plan. Listeners assume all risks associated with implementing any information discussed on this show.
Hello and welcome to the Chronic Truth Podcast. I'm Kimberly Nash. Today's guest is Dr. Debra Hendrickson, a board-certified pediatrician in Reno, Nevada, clinical professor at the University of Nevada School of Medicine, and the author of The Air They Breathe. She is on the front lines of caring for patients in one of the fastest warming cities in the country and helping people understand how heat and climate impact our health, especially those living with chronic health conditions. Today, we're talking about something many people don't realize, how heat, medications, and chronic illness can combine to create a hidden health risk and what we can do to stay safer.
Thank you, Kim. Thanks for inviting me.
Share a little bit about yourself with our listeners.
Yeah, so I was a practicing pediatrician, like you said, in Reno, Nevada for nearly 20 years. And Reno is the fastest warming city in the United States. So we're not one of the hottest cities. That would be places like Las Vegas and Miami and Phoenix. But we're the place where temperatures are rising the fastest. We've seen more than 7 degrees Fahrenheit of temperature rise since the 1970s, which is quite fast. And so we've seen a lot of environmental changes, and that's showing up in our clinics in certain types of illnesses and problems showing up more often, both in pediatric and adult clinics.
Yeah. With Reno, one of the fastest warming cities, what changes are you seeing in patients and families because of this increasing heat?
Yeah, so the main thing we've seen in Reno is air quality changes, which have a lot of diverse impacts on people's health, especially people with chronic health conditions. So we're about 10 miles from the California border. And of course, California has seen an explosion in these very large wildfires over the past 10 or 15 years. And so we're directly downwind of those. And so the city will just get engulfed in smoke in the late summer, early fall. And we have a lot of kids coming into the clinic who are struggling to breathe, having respiratory problems. And at the beginning of my book, I tell the story of how I started writing the book. Was this one little girl came into the clinic with respiratory symptoms during one of these smoke crises or smoke waves, we call it. And I had a background as an environmental analyst and planner, and I'd actually gone to graduate school in forestry. So I understood the link between these events and also the pediatric health risks that were arising as the temperatures were going up. And we've also seen, of course, the impacts of heat directly, like teen athletes collapsing during practices, especially early when in the season of fall sports when they go back in August. That's the peak risk period. So all kids are being affected in our town, and we're seeing a lot of that come into the clinic. But it's especially kids with chronic conditions like asthma that we worry about the most.
That's what I was going to say, because I do know, asthma, you have to have pretty much a clean breathing space. And with the smoke or the wildfires, etc., that's probably hindering your particular area.
Yeah, and a number of studies now have come out showing that the wildfire smoke, really disproportionately impacts children with asthma. After the Camp Fire in 2018, which is the fire that destroyed the city of Paradise, that's just west of us, that smoke mainly circulated to the Bay Area, so they did a study of how it affected asthma visits in children, and they found that in the 2 weeks after that fire started, asthma exacerbations went up 76% among children in the Bay Area. So it has a big impact, fairly quickly on children, on anybody with asthma or lung problems.
Right. Well, and their little bodies are so small, their lung capacity is a lot more affected, I think, quicker than an adult.
Yeah, kids are vulnerable for lots of reasons. Well, three big reasons. Their physiology is different, which means their bodies function a little bit differently in ways that makes them vulnerable to environmental hazards. So one example with this is that they breathe faster. Little children breathe faster than adults, and so they're getting a bigger dose of air pollution than an adult is, relative to their size. And then their size is the second issue because they're smaller. And so they, like in a car, they're going to heat up faster than an adult, and they're getting more dose per pound of weight, like I said. So that's the second reason they're more vulnerable. And then the third reason they're more vulnerable is that their organs are still forming, and so they can be easily disrailed in brain or lung development by pollutants in the atmosphere. And we have really good evidence of this from research on fossil fuel pollution that
Yes.
kids who live near highways or very busy roads have grow up to have smaller, stiffer lungs. Their lung capacity is actually stunted, and they have higher risks of certain cancers. They have higher risks of neurocognitive problems because the pollution we now know, and this has really been an explosion of new research over the last 10 years that's very alarming, showing that air pollution has a big impact on growing brains and on all of us, but especially, children's brains are growing so much in the first years of life, and the particulates can invade the brain and cause disruption in normal brain development and cause problems in how they think and, their lifelong prospects. So it's a big issue long term for them and for society.
For society.
Yeah.
As far as your book, tell us a little bit about that. What drove you? You shared obviously was that little girl, but what other aspects what other aspects prompted you to write this book?
I thought that there were not many people who had my background, both as an environmental science background with being a pediatrician, who could kind of bridge that gap for parents and explain how these rising threats because of the planet warming were going to impact their children's development and future. One study showed that more than 90% of the global disease burden of our warming temperatures is falling on children under 5 years old. And, and that also just really bothered me from just a moral and ethical perspective that these choices are being made every day for people who have no voice in the process, small children, and even those who aren't even born yet, who are going to inherit the consequences of what we're doing. And also because I wanted people not just to fight against this possible future that's being created by all the air pollution, that's creating this blanket over the
Right.
earth basically and causing temperatures to rise, but also to imagine this much better future that we could create for kids. And that's why the final chapter of the book is called The Possible World, because all of us who are alive today, we've never lived in a world where we didn't have this problem because we were all born after the Industrial Revolution. But
Yes.
imagine think back when this, not that we want to replicate this, but when COVID shutdowns happened, we got a glimpse of what cities without air pollution could look like. The pictures of Los Angeles and New Delhi and other major cities around the world that suddenly had crystal clear air. I think there is this possible future that technology now affords us where we could spare kids and all of us so many chronic health problems that are exacerbated by air pollution and heat if we make this transition with the speed that we need to make it.
Very good. Very
Yeah.
good. What do you recommend for physicians that see a bunch of pediatrics coming into their clinics with breathing problems, or do you have any insight that you could give to them? Because we do have physicians that tune into the show as well. Do you have any, insight that you could help them in treating their practice?
Yeah, and actually just am completing a chapter for an academic book on this as well as my mass market book that I wrote on this. Um, I think for physicians, you're going to see these present in two different ways. One I call the proximal, and the other is the distal. And the proximal are things where there's some major weather-related event, like a huge wildfire smoke event or a heat wave or a hurricane, And then kids come in right after that with problems that you can pretty easily tie to those events, like an asthma exacerbation or heat exhaustion or trauma from losing a home in a disaster. The others are more subtle and harder to see, but I think physicians need to be aware of it. These are things like the neurodevelopmental impacts, like chronic diseases, because these pollutants and heat can also affect development from the in utero period through life. And so I think it's very important for physicians to educate themselves about the range of problems we're seeing and what might be attributed to these rising, the rising weather-related problems we're having. But I think it's also important for physicians to recognize what they can do both to prepare their patients for this. I think there are adaptations we all need to make to these rising temperatures. And there are things we can do to try to prevent this problem from getting worse. So if I don't know if you want me to go into those as well.
Yeah, that would be perfect. Yeah, if you could.
Okay. So adaptations, and this is on my website also, debrahendrickson.com. There's a handout, a two-sided handout with that summarizes a lot of what I'm about to say.
Beautiful.
But so like adaptations to what wildfire smoke would include things like getting a freestanding air filter in your home, and there are instructions for building them if you can't afford to buy one. Putting masks on kids when you go outside, an N95 if they're big enough to wear one of those, or covering their baby seat with a damp blanket. Paying attention to the air quality index. You can get an app on your phone that'll tell you, and if you have a child with asthma, you don't want to have them playing outside too long if air quality is really declined, especially if it's over 150 AQI, then you're getting into some risk zone. Things like that. And there's a long list of things. And with heat, it's things like making sure you do your errands early in the morning, making sure the kids are getting shade breaks, that their coaches, if they're teenagers, that the coaches know about the risks and have precautions on the field, like a tub of cool water to dunk them in if they get too hot. There's also a heat warnings you can look at for your county during the summer online to see what the risks are that day. So there's various things that parents can do in all these types of disasters to prepare and protect their children.
Protect the children. And I also just want to put out there, when my kids were going through school, my son was in football, and they'd have what's called two-a-days. So they'd have one in the morning, practice early morning, and then one was like the mid to later afternoon, which was like, to me, the peak heat of the day.
Right.
And he would come home just so exhausted and just spent. And I think that our schools and our coaches need to be brought this to their attention, that it's a health risk.
Definitely, especially for football players, because they wear all the extra padding that decreases their ability to sweat, and because a lot of the most heat illnesses occurred in linebackers, which tend to be, big kids. Obesity is another risk factor for heat illness. So those kids especially need to be careful and take precautions. There are National Athletic Trainer Association guidelines for high school coaches, and it's a good idea in your community to talk to the coaches and make sure they're aware of this rising risk. Yeah.
Yep. So parents that are listening to this is something that you could be proactive and just, make sure that the guidelines are being followed.
Definitely.
I mean, to me, there's no gain worth risking the life of a child. So
right. Absolutely.
That's one of my things that I'm very passionate about. These poor young ones are, hurting themselves just because they need to win.
Yeah.
How can common medications affect the body's ability to stay cool? And what are some warning signs people could watch for on that?
Yeah, there are a number of medications that increase the risk of heat illness because they decrease your body's ability to cope with the heat or to sense the problem. So we regulate our heat by through the nervous system and the cardiovascular system working in concert with our skin. And so any medication that's going to affect the cardiovascular system, for example, beta blockers, which are very commonly used for hypertension, those can affect your ability to compensate for the heat by dilating your blood vessels and increasing your heart rate. Other medications that you have to watch out for are like anticholinergics, certain antipsychotic medications, antihistamines, which dry you out. So certain diuretics that people also take for hypertension. Those are all things you have to be careful about. And certain combinations like ACE inhibitors with the diuretic are particularly dangerous in the heat. So I think the thing to do is to be sure to talk to your doctor about your medications as we're heading here into the hottest part of the year and
Yes,
see if you have any increased risk because of it and have a plan for what to do if like your air conditioning goes out. Identify the cooling centers in your city if your city has them. A lot of major cities do. Just have a plan for high temperatures and how you might take better care of yourself in light of that. And there is
very
one
good.
class of childhood medication too. I mean, all of those kids can be on a lot of those, but less commonly than adults. But ADHD medications in children also
Oh,
are considered a risk just because of the effect they have on metabolism and heat regulation.
so parents that, have a child that is on any ADHD medication, that's extremely important.
Right.
And I do know too, ask your pharmacist. Most of the time when you go pick up prescriptions, there'll be warning labels. Uh, they're there to answer any questions about medications. So, if your doctor doesn't get back to you right away, I strongly recommend, just asking the pharmacist, is this something I need to watch out for in the summer months?
Yeah, definitely. Mhm.
What are some practical things uh, a parents or even those for the elderly, what can they do today to protect themselves and their family during this hot summer season?
Yeah, I would just make sure if you don't have air conditioning that you do know where those cooling centers are. And then on the very hot days, you have a plan for how to keep cool, through, a pool in the yard or finding shade or going to a movie in the afternoon,
That's a good
something,
idea.
something to stay cool, is a good idea. And like I said, just being aware if there is a heat wave warning coming for the town, and those are usually announced by the weather, local weathermen or online. And also if you have small children, one big risk, we mentioned teen athletes, but small children in car seats is another group that's very at risk in hot
Ooh,
weather. So cool off your car before you get your baby into the car. And if you don't, if you have a newer car, you may already have an alarm system that will let you know if you walk off accidentally, and leave the baby in the
I
car. But you can also buy devices now that attach to the seat and your phone, and it'll alert you if you have, how
strayed too far away.
if you stray too far away from the car and leave a baby in the car. Yeah.
Yes,
Yes.
yes, because that's very important as
Yeah.
well. That's
There's
extremely important.
There's one other group I wanted to highlight, which is pregnant moms. They are at especially high risk of all these environmental impacts. And for people who are interested in chronic health problems, I don't know if you've ever heard of the fetal onset of adult disease studies. Very interesting. Yeah. So in the 1980s and 1990s, this British epidemiologist named David Barker he went back and looked at records of kids who'd been born in this one area of England who were low birth weight, who weighed under 5.5 pounds, basically. And he found that they died at much higher rates from ischemic heart disease. And he started this whole line of research into why. And it turns out that babies who are undernourished in utero or whose mothers are under a lot of severe stress, environmental stress, that it reprograms the body in ways that make you more susceptible to diabetes, hypertension, and heart disease later in life. And it's been replicated over and over. So it's a reason, we need to take care of pregnant moms and babies for lots of reasons. But in terms of the societal cost of chronic disease and the long-term impacts, it's
Yes.
yeah, very important.
And I think right now what we're seeing on our end doing this podcast is chronic conditions are on the rise
Yes.
across the board. And when you add the environmental impact to chronic health, it even adds another layer of concern.
Absolutely. Yeah. The added insults on top of insults, that people are suffering from. Yeah.
Yeah, very good.
Yeah.
Where can our listeners get in touch with you?
Through my website, there's contact information on the last page of my website. And Yeah, and that's usually the best way to reach me.
And what's the name of your book again?
The Air They Breathe. Yeah, and it comes
Beautiful.
from the fact that children's bodies and all of our bodies are so integrated with air quality and so affected by the environment around us.
And I strongly recommend that to parents of young children. And also, if you're in the medical community out there, get this book, just enlighten yourself a little bit. I don't expect every doctor to know everything about every condition, but if we can just feed a little bit and just be a little bit prepared in case something does come across our patient day, that we can, help them out. So I recommend that.
Absolutely. And there are physician groups organized around these issues, where we can share information and advocate in our various states and communities on these issues.
Beautiful.
So,
And they could probably just reach out to you on your website to get that information, correct?
absolutely. Yep.
Okay.
Happy to share.
Beautiful.
Yeah.
Beautiful. Thank you so much for coming on the show today, Dr. Hendrickson, and sharing this extremely important information with my listeners. If this episode has impacted you, please leave us a comment and also be sure to subscribe to the show. Your support is helping us build a community of support for those fighting serious chronic health conditions. And until next week, not without a fight.